I want to thank you very much for your patience. I want to thank you for keeping time. Many apologies for the technical challenges that we've experienced. Many of our colleagues continue to experience challenges joining us, but they are being helped or they are working at it, so they will join us. I think in the interest of time and respecting the fact that you've been patient and online, we are going to start now. My name is Sarah Chizan Sigai. I am the Executive Director, Native Voices International. Welcome to this White Ribbon Alliance Native Voices Partnership, where we are holding this orientation about respectful maternity care. This is the first in a series of events that we are going to embark on in a campaign to promote respectful maternity care, but also in line with the mission and vision of the White Ribbon Alliance to make sure that no woman, but also no child, no woman should live a life while bringing a life, but also no child or life should be lost. And that usually happens in the process of giving birth. We are doing improvements now thanks to efforts of entities like White Ribbon Alliance, USAID, government policies, health workers, but still we are very challenged. That is not my place to discuss. Herbert is the expert who is here with me. Hello Herbert, say hello.
Hello.
Herbert is the lead facilitator for today. I'll give a proper introduction, but I would like to come back to today's orientation. I think about 5 years we used to lose, no, about 10 years ago we used to lose about 432 women would die, that's what we would lose annually during childbirth due to a number of challenges or reasons. One of which was access to health facilities. The other was failure for women to go and access health facilities, failure to go for medical checkups, how do they call that, labor, so that problems antenatal, so that problems are identified early. But we have made some gains in as far as creating awareness, in as far as access, creating access, in as far as women actually reporting to antenatal, in as far as husbands and families supporting expectant mothers. But that does not mean that we are there yet. We are still largely challenged. We are losing a lot of children. We are losing a lot of mother. There's something that people have not dealt with called postnatal trauma. And that's an area that Herbert is better placed to talk about, and he will be explaining. But why the campaign? The White Ribbon Alliance is a people-led movement, and Native Voices International believes that communities and people, if they participate in processes that affect them and come up with the solutions and are stakeholders and involved in the solution finding process, we can actually deal with a lot of problems and we can eliminate a lot of problems. So as such, we empower communities to take charge of their destiny. And how do we do that? We use media and arts, because we trust that the potential of the audiovisual language, film, but also art and drama, it's a universal language which anyone would understand. Music, we sometimes don't even understand. We don't know Spanish, but we would love Spanish music. Same applies to the differences we have in a country like Uganda, where you have over 54 cultures, different cultures and languages, but we are the same country. How do you communicate? How do you domesticate policies? How do these policies get operationalized? If people don't even know about these policies, how do people actually access help if they don't know that it exists? So we use the universal language of art, and how we do it as Native Voices is we find communities in their localities. So outreaches, particularly using community screenings and dialogues, is one of our major programming. But beyond that, by 2016, we also realized that in as much as we are the same, we are also different, and different cultures, different people have a lot to bring to the table, and indigenous does not mean unknowledgeable. There's a lot that can be tapped from the communities, but there's also a lot that the communities can tap from the national care, from the international community, from just knowing and sharing information. So how do we do that? Is we're also looking at the challenges of communication in as far as electricity. Now we are getting a lot of electricity and energy in the rural areas. We are getting mobile phones and people can access information more than before. But before, access to information was a challenge, and that doesn't mean that when people get information they are able to interrogate and understand it or domesticate it. So we go to those communities. Now what we have also started doing is introducing the multimedia skills to communities, by especially marginalized communities, by going there and training people in filmmaking, in writing, and other related artistic fields. And as such, we have, I think, about 200, I know over 200 filmmakers, aspiring filmmakers. Some are now practicing in Karamoja, in Rwenzori region, in West Nile, in Kampala, and we want to extend that by working with more communities. So as such, we are partnering with White Ribbon Alliance to further this agenda of introducing multimedia skills in communities, but also tapping on existing skills. And this is where the media comes in. The media is very critical as a mass communicator to take this information to people. But the media has to also understand and appreciate this information. So that's why we felt that, because we want a people-led movement, for communities to take charge of this. First of all, to own the process, but they have to first know what it is that they own. And the media comes in by dissecting that information and sharing with the respective communities. That can be radio, that can be traditional media, that can be new media, that can be bloggers, that can be the formal media as we know it, print, television, and radio. And as such, we invited you to work with you. This is a pilot. We want to journey with you and first of all break down what is respectful maternity care. And as Herbert will be explaining in a bit, there's a difference between maternity care, because it's its entirety, and maternal care, right? So we want you to also go into understanding respectful maternity care. I am aware that you are already doing amazing work promoting that in your communities, but probably not with a conscious effort or driven by a campaign that this is what we are going to work on. So Herbert here will be guiding. So this campaign is going to be national. This campaign is going to be national, but at the same time we are focusing on 4 districts. The 4 districts are Iganga, Kamuli, Jinja. Herbert here will explain why the choice of Jinja, but I think you're also aware of Busoga. You're aware of the statistics, and then Masindi, and then at a national level. So you will realize that at a national level, we are working with a number of people. Native Voices, as already explained, has alumni in Karamoja, in West Nile, in Rwenzori region, which covers like 9 districts, including Kasese, Fort Portal. I don't want to go into the geography in the interest of time, but we are also in Chigezi region, particularly Lukunjili and Chisoro. Chisoro is our major base. So we hope to work with those people and others. We also look at the partners who are in Kampala and these media houses that are national in nature, that even if we are based in Busoga region, the campaign is currently focusing on Busoga region and Masindi, your voices will represent the nation. Why? Because when they get information of what's happening there and what can be done and the efforts that are being done and the amazing health workers doing great things, but also the people who are challenged, it also makes them think. But we're also looking at policy. How do we inform policy and how do we influence policy? I think this and more, and how we are going to work together and the expectations is what we'll be discussing tomorrow. But for today, I'd like to introduce Mona Herbert, a development communicator a journalist like you, a trained journalist, but who sort of like channeled into the development world, and he has used that experience of being a media personnel and a development communicator to actually promote reproductive health, but also development, youth, and a number of other things. I don't want to talk for the person who is next to me. Welcome, Herbert.
Thank you.
Great to have you.
Thank you. Morning, everyone. At this juncture, I first want to really welcome you and thank you for joining and for taking the time to participate. Online, I can already see Moses, Oketa, Namalova, Mohammed, Biemboijana, Stephen Kalema, Julius Kalugu, Vincent, Tina Peace, and then someone with I think with the gadget name Technospark. So welcome, and I hope other colleagues will join us. I want to start somewhere, and for us to have a better understanding. Of course, I'm going to talk about specific elements in this campaign, but I want us to go step by step. Today is not a day where we want to overwhelm you with a lot of information. It's supposed to be the first day of orientation, which means we simply want to usher you into what it is that we are trying to do, and where now you get the opportunity or the privilege to be invited and then participate, bring your expertise. So from the onset, I have to make it very clear that we come to people like you who are already experts in your own field. And there is nothing we can add there. If anything, we are just tapping into your expertise. But what we intend to do with Native Voices International and you now as part of the make is to invite you to come into what we call a consortia. A consortia is where people with different expertise come, use their expertise and share knowledge or advance an issue. Okay? So I'm going to talk about the organization that now is working with Native Voices International. And then I'll talk specifically about the kind of additions or the kind of expertise that we want to share with you to add on to your expertise as media professionals. And then I'll dwell into the subject matter, what Sarah has already hinted on, and that is respectful maternity care. And to try and just give you a quick overview of why we think this is an important area. And then when that is done, I'll come and briefly talk about what we want to do moving forward and the format of work that we are going to kind of dive into. And I think that should be enough for today, day one. And then tomorrow, Sarah will then take us on in terms of what exactly are we going to do and how are we going to work. And maybe Sarah, as we close today, will also talk about the fact that this is the first orientation, and Native decided in the format of work that it should be online, which will then be followed by another orientation. And Sarah will talk about that. Because with those two orientations, then we'll be ready to work. As I said, you're already experts in media, so there is nothing we add on there. But let me talk about the sequence of the topics that I want to cover now very quickly. Let me start with the organization that I represent now, and that is White Ribbon Alliance. As Sarah briefly hinted, White Ribbon Alliance is a people-led movement. It's a global movement. And here in Uganda, White Ribbon Alliance in Uganda specifically focuses on the rights of women and children. And of course, children come as a subset of the women because the women are our mothers, if we want to identify ourselves as children. And in that field, White Ribbon Alliance takes on a pride and a very strong focus on what are the interests of women, what are the issues that really concern women, and how can those issues be dealt with so that at the end of the day, women have better rights recognized, women's voices are heard, if there are issues they are advanced, if they need platforms to address certain issues, these platforms are present. And that's what White Ribbon Alliance does. Now, you can always go online and type in the word White Ribbon Alliance, and you'll be able to see a whole range of the kinds of campaigns that we do. So the organization has offices globally, okay? And its headquarters are in the USA. But here in Uganda, we have an executive director, Dr. Rose Bisogorwa Mukisa, and we are not such a big team. So in White Ribbon Alliance, me as Mona, I work as a consultant, and my focus is on advocacy and communications. That's what I advise in the organization. And this particular meeting that we are now finally having with Native Voices International is something that I crafted, which is informed from my background. As Sarah said, I'm a media professional as well, way back, and I trained with Sarah. But then as I did my work, I drifted into development work, and it has given me an opportunity to really do a lot of things, learn a lot. And where I stand right now, I want to use the opportunity to bring back the development aspects, at the same time tailored with my background in media where you sit, and then we see what we can do to advance development, so to say, in Uganda as media practitioners. So that is where I am at the moment, and I use every opportunity to try and advance that kind of work, the body of work. So in White Ribbon Alliance, we designed a project, and the project is titled Advocacy for Respectful Maternity Care. And this project is meant to focus on specific areas or target specific audiences that we work with to advance respectful maternity care. So the project itself works at the national level, that is the meso level, but a lot of work is supposed to take place at the national level is the macro level, the meso level is the districts. Now, what we did, because it's a pilot and it's a start, we targeted specific districts which we feel are pertinent in terms of indicators, that the maternal health indicators are not really good, maternal mortality rates are high, and so many other issues regarding maternal health are keenly followed up because there are all these challenges. So we specifically targeted Masindi because it's a high priority area when it comes to maternal health indicators. We targeted Jinja, Kamuli and Iganga. And then because the project is USAID funded, there was another loop where another project led by FHI 360 decided to say, can we also carry out similar activities in Kampala? Because believe me or not, when you hear challenges of maternal health, you might think that all the districts based up country are the ones that are having challenges. But if you look at the indicators, and this is one of the things that I'm going to start introducing to you, that usually as journalists, we always just go for the, what we call, in development language, they call it the low-hanging fruit, that when you find a mango that's very near, that you can stretch your arm and pluck it, that's what you go for. But we are going to start going for the high hanging fruits, which would mean ideally that we are going to take interest and dive deeper and get the facts, get the indicators, get the statistics, because these are very important for us. So when I tell you that Kampala is one of the districts with high incidences of maternal mortality, which means death, either for the newborn or the mother, or when we talk about challenges like postpartum challenges, like bleeding of women during maternity, where again we get fatalities, those issues are of high numbers here in Kampala. And it's really strange. When you hear it for the first time, you would assume, but in Kampala, I would assume that they are okay, because one, we have a lot of government facilities. Number two, we have a lot of private not-for-profit. Again, I warned you about the terminology. So when we talk about private not-for-profit hospitals, if you hear hospitals like Rubaga, if you hear hospitals like Namirembe, Nsambia, Chibuli, and then Uganda Muslim Supreme Hospital in Old Kampala, and a few others, you will realize that those hospitals sit with private entities, which are churches, mosques, and the like. Church of Uganda, the Uganda Catholic Bureau, then we have the Muslim community. But those hospitals have to invest, but they are not meant to make profits. So they invest money so that they can offer service of medical care, but all the expenses that they incur, that's why they ask people to pay. When you go to government facilities like Chirudu, you go to Kawempe, which is the epicenter for maternal health in Kampala, then you go to Mulago. These ones specifically are meant to be that people go in, you're not supposed to pay, you know, and these are government facilities. And then we have private for profit, where you go really to private hospitals like Nakasero, like Kampala Medical, and all these others, including also clinics and all these other places. So all those categories offer services. But at the end of the day, it's interesting that if you look at Kampala, you'd have all these different levels of service providers, Health Center 3, Health Center 4, National Referral Hospitals and the like. But the incidences of maternal deaths and maternal challenges in Kampala, by and large, are high. Why is this? So we'll have to do deep dives into the plans, into the reports that are coming out so that you can appreciate this. Now you might already begin to ask yourself, as a media person, why should I take interest in this? Because, ladies and gentlemen, you need to begin to appreciate that we as media professionals are also supposed to play a role. And indeed already you're doing that. But what we are going to do now is to bring advocacy and build our own agendas as media personnel and begin to advance this work. As opposed to when, as a media person, you only follow a story because you hear an incident happened somewhere in Kamuli where an expectant mother came, stopped at the gate, they refused her because she didn't have a mama kit or she couldn't pay, and she bled out and died. Oh, as a journalist, you run after that story. Why? Because it's newsworthy. But behind that unfortunate incident, you need to dig deep and ask yourself what exactly is going on in Uganda. What is the problem? Let me give you another scenario just to divert you a little bit, but then it's connected. You all know recently we lost our speaker in parliament, now the late Jacob Olanya. The circumstances surrounding his death, everyone had their own take, they had their own share, we all shared opinions. And the media was awash with so many things. But again, the agenda of healthcare in Uganda and our health standards came up so much because everyone was now talking about the specialized hospital in Lubowa, why is it not finished? And of late, in the recent days, you've seen parliamentary committees on health asking the Social Services Committee making reports on what has happened, what has not happened, the contracts that were given out, and the hospital is not anywhere to be seen. And these debates will continue. So the question then comes in, where do we stand with our medical health care in Uganda? At the policy level, for as long as I've been involved in advocacy for health, and I've been part of the team in part of my development work, I've tried my level best with other organizations and other agencies and stakeholders to push for Uganda's aspiration and target of getting medical health, medical insurance for every citizen in Uganda. As we talk right now, that policy is a total stalemate. Because number one, whenever they bring the certificate of financial compliance and the like, it's too huge a bill. And then they're asking where is the money going to come from to ensure that every Ugandan is medically insured. That's a whole nother debate. It sits with Parliament. And we can also take an interest in that using our angle of maternal health. But let me come back to our subject of respect for maternity care. Number one, it's a subset of maternal health. Now, again, today at the end of the day, please take time if you're interested. Go on Google and type Uganda and talk about, and type in Uganda maternal health updates. you'll see millions of documents and you'll be able already to pick a lot of information regarding that. But the specific topic that we are going to be talking about, which is respectful maternity care, I will not go into technical details to explain it, but let me try to give you kind of context so that it begins to sink in and already you make connecting dots. Imagine a mother who goes to a hospital and she will not be given a service simply because she doesn't have the money to pay. Imagine a mother who, when she's expectant, all the 9 months she goes for maternity, antenatal care and checkups, but the partner never, even for once, escorts her. So you'll find a lot of mothers who are in hospitals and they've gone for antenatal care, but their spouses and their husbands or boyfriends or whoever are not there. They're not present. Okay? Let's try to make maybe a different and take a different angle. We all know that when we go, and you guys, the journalists, you know this better. When you watch TV nowadays, you see translators, people who are using sign language. And at some point, perhaps that became important and people recognize that. As long as you communicate, it's important for those people who, in our development language, and guys, I need you to pick this. It's so easy for a journalist to say deaf and dumb. In our development aspects, we never use such terminologies. What we use instead is people who are abled differently. So let's put another context and paint this picture. Imagine a mother who goes for maternal health care services, or she wants to deliver a child, but this mother cannot speak and goes into a health facility and finds a midwife or a gynecologist, a doctor, and they are supposed to explain their issues, to explain how they feel, to tell the doctor so that the doctor can do a proper diagnosis, a follow-up, and give them the services. Now, here is the conundrum. Number one, you cannot blame the doctor because the doctor is a medically trained professional. But right now, they are handicapped, they don't know sign language. Here is a mother, expectant mother, who has come in. They want to talk to the doctor, but they are using sign language. Now, that is a gap. So how do we solve this? Or better yet, whose responsibility is it to cover that gap? What about an expectant mother who doesn't have limbs? And by limbs I mean they don't have legs, but they are supposed to go to this hospital. Number one, they will crawl in. Number two, I want you to use your own imagination of how our maternal cubicles or wards are. You know, the dynamic that's in there. Because I can tell you frankly that in Uganda, unless you go to a private facility, if you go to public facilities, you'll find 6 women all in the maternity ward pushing children at the same time. Okay? Think about that. Now think about this mother who is crawling in without limbs. And guess what? If you go to many facilities right now in Uganda, the delivery system and the delivery bed will be the same. But no one has even put those, what are they called? They are called these support, the support ladders, the wooden ladders where this woman perhaps can push her body to go up on the delivery bed. But remember, she doesn't even have legs. So how is she going to use these pressure points where she can use to put her legs and then push the child? You should understand that when we talk about respectful maternity care, we have the so-called charter. It's a global charter. And what in our advocacy as White Ribbon Alliance, in one of the deliverables we have, is we want to domesticate this charter so that Uganda accepts it and understands it and buys into it and adopts it, but to our local context. But some of the things that this charter covers are those exactly, that it's a woman's right to choose the type of delivery and the method of delivery that she's going to use. Now, when you go to those other countries, you find that women can deliver while squatting, they can sit in specialized chairs, they can climb on our bed. Here in Uganda, that is the standard we have. We've known of women who use this aquamarine system and they go into what we call delivery bathtubs and they deliver underwater when their bodies are immersed underwater, not the head, but at least the rest of their body. All these types and systems are there. Now, when you go and talk to our poor midwives, the people I really want to call heroes in Uganda, are they given chance to exercise and give women all these options? No. Whose responsibility is it? That is one of our homework, and that's one of the things we are going to explore. as the people who are going to be using media and advocacy to really explore what is our reality in Uganda. When we talk about the charter and we say a woman should be respected, in Uganda, I can tell you frankly, we've done orientations with medical professionals. We've seen medical professionals who frankly testified and they said, no, sometimes it's important to slap women because they are lazy. You see, you're telling her to push, she's not pushing at the right time, and then we lose children, we lose babies just because the woman has a child, she's just being lazy and whatever. So we slap them. And I can tell you there is nowhere in this world, and specifically in Uganda, where it gives a right a medical professional, a gynecologist, a midwife, a nurse to slap a woman who is in labor. That is unacceptable. But I need you guys to understand that when you go and you look at how midwives and medical professionals and gynecologists work, you might want to question whether it's your right to blame them. And I'm not condoning this, I'm not justifying the slapping, it's wrong. And when we talk about respect for maternity care, that's why you see that so many women will not go for antenatal care and will not go to these hospitals. What do? They go to the TBAs. TBAs are traditional birth attendants. And right now, in the penal code in Uganda and all the other laws that we have, all the standard operating procedures, TBAs are not allowed to perform any service regarding maternal care. And they are not supposed. The best thing they can do is to encourage women to go to hospitals, to see medical professionals. They are not allowed to assist women during delivery in their homes. But despite all that, and that's why you see sometimes you get cases of women who have what they call obstructed maternal procedures, where the child is obstructed, they can't deliver and the like. And I say this with a lot of caution because I'm a development worker and a media person, so an advocate. I'm not a doctor, you know, but we'll have opportunities to talk to the doctors who can carefully and well explain all these terminologies. But imagine a woman who went to a traditional birth attendant, you know, and then the baby somehow is obstructed, the baby cannot come out. That would require a hospital. That would require a gynecologist, it would require surgeons and the midwives and all those professionals. But why do women still insist to go to these TBAs? Sometimes because they feel mistreated when they go to hospitals. They are backed at, they are not respected. Sometimes a woman would want to go with their spouse, even in the labor ward, and then the nurses and the midwives will just say, no, you have no business here as a man. Get out, get out, get out. It's their right. So all these rights, and you look at the charter, you'll have all the information. It's very, very important for us to begin to advocate and to push the agenda. That when we talk about respect for maternity care, we are talking about a woman who goes in whatever condition, they go to a hospital and they're supposed to get a service. Our reality in Uganda right now, ladies and gentlemen, is so different. If you go to our health centers and you talk to midwives and nurses, guys, you'll be shocked. I can promise you that one of the things that we've seen that has been so shocking is to reach health centers and you find a nurse or a midwife who has done a 72-hour shift. How do you expect that person to be receptive, to be welcoming, you know, to be warm to patients? And they are exhausted, they are tired. I've heard of midwives who've told me that they have some of their colleagues who need psychiatric help because they've had and received a lot of traumas. So all these things come into our dynamic. And what is our responsibility as journalists? We need to raise this issue. We need to raise the agenda. We need to amplify this issue. But as White Ribbon Alliance, working with Native Voices International, what are we saying? We are saying that, number one, in this project, which we call the Respect for Maternity Care Advocacy Project, we are going to work with the media people, and this is us. That is our whole objective. And what we are going to do is to work with what we've termed as a media lab. We are going to sit together and agree on all the things that we want to bring out. We are going to develop themes. We are going to take our angles. Remember, I told you guys, you are the experts. So you could be seated with us right now. You're a media person in the newspaper, in the radio, you're a blogger, you are a videographer, you do documentaries, you do whatever, you do programs on radio. It's everything to do with media, including people we can encourage who are the so-called citizen journalists, people who don't do media as their day-to-day work, but then they can write, they can communicate, they can champion issues. And why are we doing this? Because as I told you personally, I feel that media can do a lot than just reporting stuff, than bringing out issues and the like. If organizations and civil society organizations are advancing a lot of advocacy, I feel that media is even much more privileged and more positioned to do this. Why? Because you have a lot of platforms, you have a lot of listeners, everyone looks to you to get all the information, and this is very, very important. So that is what we are going to focus on, and that's what we are going to do as a group. And how is this going to work? So number one, White Ribbon Alliance has other objectives that they are covering, for example, working with the districts, working with health centers, and at the national level we want to bring the agenda to the people who we call the stakeholders and the decision makers. There, as our lab on Native Voices and us coming together, we will play a role, because we'll be able to bring all these contexts and realities and project them at the national level. At the same time, show the decision makers that this is what's happening and this is our reality. So we have a role to play at the national level. We have a role to play to raise all these agendas in our respective localities. So someone could be already here, seated with us in this virtual forum, and they are based in Masindi. So after understanding and getting a good orientation of what we are going to do, you say, okay, regarding respectful maternity care advocacy, these are the things I'm going to focus on in Masindi, and this is the work that I'm going to do. And I'm sure Sarah is going to explain and give the details of what our deliverables will be and how we want to work. And that is what we are really going to do. So I want to come to kind of a close of what I wanted to share by reminding you that number one, you are the experts. Our job really is for us to coalesce and to come together. And usually when people come together, they share their knowledge and they share their expertise. So most of our work, or particularly for me and my colleagues, will be to really orient you guys in respect to maternity care, to understand the whole space of maternal health in Uganda and where we sit. But once we do that, then Sarah and you guys take on the lead to say, okay, this is what we want to cover, and this is what we want to do, and this is where we are going to go with the story. Each and every one of you, or each and every one of us, will have an opportunity to fly free, to really go and explore what you want to cover. But we'll work together to help you develop themes, develop angles, collaborate. Because if you're going to do something and you really feel it's a very strong theme, and you feel, okay, I'm a radio person, I want to do 1, 2, 3 things. But then I think it would be nice to have a blogger with me. It would be nice to talk to my colleague in New Vision or Monitor. It would be nice to call Sarah and we say, can we do this and the other? That is what we are looking for. Because at the end of the day, the body of work that we are going to create is going to speak volumes. And what is going to happen is when we bring it to the national level, we will target specific audiences. For example, it could be that with our stories, with the videography, with the photography, with everything that we want to do, we say, why don't we do something with the parliamentarians, through the health committee, through the women parliamentarians and ministers, through what? We can do everything we want with our material. However, we all need to be very clear. Why are we doing what we are doing? Because it's very possible that me, Mona, I'm doing this because at the end of the day, Sarah will give me an allowance, and that's my motivation. And there is nothing wrong with that. It could be that you're seated there and you're saying, okay, if I can do this, and at the end of the day, it gives me mileage in one way or the other, it's a good thing. But we all need to agree at the end of the day, number one, what does this initiative in advocacy aim to achieve? And number two, what is our contribution to this achievement? And number three, how are we going to quantify our deliverables to say we've done this and this has been our impact? So we need to be very clear on what we want to achieve at the end of the day. Why? Because now you'll move beyond media into advocacy. And I can assure you, ladies and gentlemen, when you're looking for the impacts of advocacy, they can either be immediate, they can be short term, but some can be long term. And sometimes you can do a lot of work and get frustrated because you don't see the results that you want. So when you have clarity on what you want to achieve at the end of the day, that is very, very important. And finally, before I stop talking, because I can assure I can engage you for 72 hours non-stop, but I have to stop at some point and maybe hand over back to Sarah so that then we can see how we move. But what I wanted to finalize with is that even beyond this campaign, which should take a couple of months, 3-4 months, I need you to start thinking of how we are going to work together in the future with Native Voices and with a platform that I started when I thought about us working together in this project. Because that is very, very, very important. What is going to happen is that this work we start today is not going to end today or to end with this initiative or this project. I'm also working with Sarah because I'm starting a movement which is called Ideas Atelier, and my interest and what I've discussed with Sarah is that we are going to be focusing on what media people like us can bring into the development field. These are spaces where we can do so much more than what we do on a day-to-day basis. And we have a plan, and we want to really use this opportunity to do that. So please, when you commit to work with us, it should be that you also look at the long term of what we want to build together. And it's for our benefit. We will share the successes, we will look into everything that we want to do. I can assure you that it will always be interesting work, and it has to be. Otherwise, why should we do it? I'm one person who never does something that's boring. If something doesn't really excite me, I don't put my investments there, more so time. So this is what we are going to do. And I really want to encourage you. So respect maternity care, we will get a lot of information, and tomorrow we'll talk a bit more about it in detail, where probably I'll even have a small presentation to show you a few slides with some statistics and information. But what is important is that for us, our job as media, and now we are going to be ushered in by Native Voices International, we are going to be focusing on what can we play as a role to advance this advocacy and to raise the issues of maternity care in Uganda, with the issue of respectful maternity care. And what does it mean when we talk about respectful maternity care? So how should we project it? So how we understand that and the reality we are going to bring out and what we'll bring out as media people is going to define the volume of attention, the platform, and the amplification of the issue that we will receive in Uganda at the end of the day. And I hope you find it as exciting as we are here, at least with Native Voices. We are really exciting that for the first time we are working with media people in a way that has never been done before, because most of the people just invite media to a launch of a project. They invite them to do a news coverage if there has been a workshop, and that's not what we are doing. For the first time in this project, we created a whole objective where we wanted to bring the media on board and to work with them. But as I've said, this is the project and it's just the start. When it comes to Native Voices and Ideas Atelier, or what we call as the Ideas Shop, probably I'll stop for now and then hand over back to Sarah to kind of give us an overview of how we proceed. But I hope that today has kind of given you a hint of where we want to go, and we are going to be working together. We'll really check in with each other, and I think that is part of what Sarah is going to orient us in tomorrow, of how exactly we are going to be working. And then she'll basically talk about the second orientation, which should now really bring us into the understanding of maternal health and respectful maternity care, and the project itself, and how we are going to look into the deliverables. Thank you, and nice to meet you all.
Thank you very, very much, Herbert. That was very well elaborated. I always pick new things. So thank you very much. One of the reasons we worked with you online, we made the orientation online, is that, as Herbert explained, we are going to be working in this campaign together, meaning that we will journey with you. Those explanations will come tomorrow. We will journey with you in as far as doing coverage on respectful maternity care is concerned. But we are also cognizant of the fact that the project is national in nature, but it's also focusing on Masindi, Iganga, Jinja, and Kamuli. definitely not in Kampala. So we are definitely going to be engaging online a lot and working with you here. Your participation here affirms to us that you're going to be able to interact with us virtually. I don't want to go into the programming now, but your ability to communicate virtually, to participate virtually, is going to be key and critical to the success of this program. As you may already be aware, 15 million people are online. You don't want to miss that audience. But we cannot assume that 15 online people is all there is, given the nature of Uganda, where one family can own one phone and they share what is happening. So there's a lot to tap into when we work virtually, and we would strongly encourage you to participate in the virtual convenings. And also, even when we have a face-to-face, this is a project where we have very many people. So it's not who is better than who, but we may not be able to have everybody come for the launch. But we would love to have a lot of people, especially the ones up country based, come and join the launch. But we'll be doing the main training, the main workshop online. And this is where you're going to hear the experts, the reports, the testimonies from people who have experienced challenges, from the healthcare providers themselves, and it's going to be online. Yes, some people will be there physically, but it's going to be online. So,
and they'll be facilitated to attend.
And yeah, they are already, because they've been facilitated to attend. So we will also ensure to facilitate your participation virtually. But let us start the culture of participating. We would like to hear from you, your experience, your views, your response to what Herbert just presented and what we are talking about now before we proceed. As already explained, we also don't want to leave out people, but we also don't want the people who made time and endeavored to participate to lose out on this day. So we really appreciate and would like this to also make meaning to you and your time. Thank you very much. So anybody wants to say something, has a comment?
Julius Kalugu, working with 92.1 OPFM Jinja. Thank you for this initiative. I was following keenly the submission of Mr. Mona. Actually, he almost asked a question I wanted to ask, that how do you want us to advance this advocacy as journalists? Time and again, we normally have such initiatives where we put in a lot of time, a lot of advocacy, but at the last or in the middle of the program, you find we get challenges where you find the government sanctioning such programs. So I wanted to be sure whether this advocacy is not part, because I know our government operates sometimes. Something that is pro people, it comes in when the people actually have come up and the interest is there, you find some voices comes out and something which is there to benefit people. And it's along the way, you find a lot of pulling, pushing, and we end up actually losing. Remember, when I'm on the microphone, I am advocating. And when such a thing which has gone after the population, now like you mentioned in Jinja, I stayed in Jinja, Kamori, Iganga, these people listen to us. But now I advocate, then afterwards, from nowhere, I can't explain how the thing has actually stopped. Because you hear, it has stopped, the government has stopped it. So are we in connection with the government? As Mona was saying, the decision makers, the people who have the powers. Because we might advocate for something when the government says no. Because what I know, the government doesn't want to know that there is a lot of that in the hospitals or in the health centers where these mothers go. Because in most cases, when you go to these government health centers, that's why all the roads are. And when you come up and you are advocating and you are educating the mothers, their rights, that's what the government doesn't want. So how are we going to operate in such an environment? Because me, I'll be on the microphone advocating white ribbon, native voices, this is what they're advocating for. But now, how am I how am I sure that my advocacy will not end on the way, such that I don't lose my integrity when I'm speaking to my people? That's what I wanted to share first.
Okay.
Thank you for your presentation. And I think when you were talking, you kept emphasizing that you are trying to work with the seniors, and that means maybe you expect a lot from us. But I think from this training, we should know that maybe journalists are not maybe seniors, but of course we keep learning and taking the people's voices out there. So we need perhaps maybe to learn a lot from you, exactly to know what what you expect from us, but also what exactly we need maybe to do to put these voices of these mothers out there. But also we know that mothers face a lot of challenges, including their rights and of different categories. There's something that actually which you said, which I don't understand very well. When you say, like maybe a mother who has to me, I would say maybe a disability. And in our reporting, we don't normally say maybe able differently. That sometimes confuses maybe our listeners or people who are hearing from us. So I don't know how we can harmonize that, because normally we might not call them maybe people who are deaf or dumb or something like that, or blind. But I don't know if it is appropriate for us to say maybe people living maybe with a disability, something like that. And of course, we know that apart from these people, all mothers have their right to save for maternal health. And how are we bringing it out to see that maybe it doesn't show that as if government is not doing enough to highlight all these rights? Because when we see government, it will tell you that maybe we have put a number of these health facilities, we have tried to improve this and all that. So which rights are exactly maybe missing in that we are looking at, especially when we focus in these most of the regions you have chosen, like so that region, of course, we know that maybe there is early pregnancies now that we have had COVID-19. And even initially, of course, we knew that we had maybe early marriages. But does this mean that maybe because of the challenges they're going through, their rights may be being violated in such a way? Is there a way maybe they are not finding these commodities in health facilities, or exactly what is happening on the ground? Maybe for now, we'll stop there.
Thank you very much, Olivia. And Julius, do you still want to ask your question or comment?
My other concern is about the funding. Because you said in Mona's submission, he talked about USAID. Recently, I understand the government actually was curtailing funding from some sources. So I don't know how sustainable this initiative can be if, for example, there are some curtailing. For example, the other time when that is the DGF funding was cut off, how sustainable is this program in case government comes in to curtail the funders?
Okay, so I would like to share with you that there are some other participants who've joined us. And with us here, there is Angel, and there is Joseph Alineiche, also known as Chemical Ali. I'm sure in the process of dealing of this project and interacting, you will meet the notorious Chemical Ali. So Chemical Ali, I think, has a question or a comment.
Good morning, everyone. My question is one: what exact indicators do you need about maternal death rate? What indicators do you need? That's what I wanted to know. What are the exact indicators do you need for us to track?
Oh, what we need to look at, yeah?
We need to look at.
Okay.
Thank you very much. Your question is noted, and I think I will either come back to you or will respond to this. Oh, Angel here also has a question.
My question is, why is it that the first target you've targeted the eastern region? Why is that? Because also in the central and the western, they also face such challenges.
Yeah.
Why is it that the first target is in the eastern region?
Thank you very much. That's taken, we've noted, Angel, and we'll respond. Why Eastern, although Masindi is not in the east, but yeah,
And Kampala.
and Kampala, but yeah, the rest are in east, and I think we've
But we'll explain.
noted what you're raising. I guess for now we can
Go through those.
respond, and I think let's start with Herbert.
Thank you very much for the questions. And let me try to elaborate. The first thing I want to assure you is that I'm happy that these questions already are coming up because they are going to be part of our conversation. And when Olivia was talking, she said, I emphasize certain things. There are certain things I want us to emphasize because I want us always to keep them on our fingertips to understand how we are going to be working. Ours as media people is going to be a conversation, and these conversations will always take them to a level where we can share them and engage other people. And why do I begin to talk about these terminologies like conversations? Is because when you're doing advocacy, you can either be perceived in different ways. The choices that you make and how you approach the issues you're going to talk about, whether they are sensitive or not sensitive, will always determine how the perceptions of you are taken on by other people. Now, media people, as always, can either be appreciated as partners, or depending on how we do our work, we can be seen to be confrontational, or we can even be labeled to be a bit hostile. But that is always depending on who is receiving our content and how they make use of it. Of course, number one, people will always hate criticism, and it's not only government, even if it's just a usual person, a private citizen, as long as they are criticized, you know. But there are certain things that we'll have to think about. Now let me start with Julius's first concern, which was about how do you deal with the backlash? Because he mentioned of specifics of say programs that were funded through DGF, that's the Democracy Governance Facility, and what happened. And one thing, and I'm very careful some of the statements I might put here because I don't want us to get the wrong impression. But one thing we have to be very careful about as we do our work always is not to overgeneralize, okay? Because when we go into specifics, we stick to the details and we stick to the facts. That will always be the best bailout that we have. Now, when we talk about maternity health and maternal health, and we talk about respect for maternity care, the issues that we want to raise about are not issues that we are going to concoct or create. They are there. Most of them are known. The first thing I want to ensure you is that each and every one of us, as we do our work, to use media to do advocacy and to write our pieces, to do our coverage and the like, we will have to stick to the facts. Our job as reporters is to get this information and put it to the public. The decision is for the public. The dissection is for them to take on. And yes, as journalists or as media practitioners, as bloggers, whoever in our media profession, we can create agendas, we can create themes, we can point our information in a way that can build inclinations towards certain angles. But by and large, let's not forget our objectives. And that's what I said. What do we want to achieve? And that's what I'm going to elaborate on tomorrow. Why are we doing what we are doing? Because at the end of the day, if I want to talk about respect maternity care and I want to talk about the issues, as much as I might highlight the issues in the district or what's happening in a health center somewhere in Kabera Maido, I have to be cognizant of the fact that Kabera Maido expects support from central government, expects support from left, right and center, okay? And those are the facts that we need, but it doesn't take away the challenges that we are faced with. So, we might worry about the backlash, and those sensitivities will always be there. But number one, let's ensure that we have the right information and the facts, that they speak for themselves. Number two, let's always ensure that even when an issue comes up, we give the best objective possibilities for all the stakeholders to pronounce themselves on the issue. That's what usually exonerates us. I mean, it's one thing for me to say that health center so and so doesn't have this and there are no nurses and there are that. It's another for me in that same coverage or reportage to say that when I asked the district officials about this issue or this reality, this was their response, you know? And I'm not there to judge. I'm just there to tell you the facts and then for you to use the information and see what happens at the end of the day. Because the rest of all the other people who are going to use this information when it comes out to project it, they use it and say, this is what's happening. This is what our colleagues in the media are recording and this is what they've covered. And it's very, very important for us to ensure that when we do our work, it's backed by information, it's backed by facts. Number two, Olivia was asking that what do we need to do to promote RMC? Okay, that was the first thing. And I think what we are going to do is once we understand what the issues are regarding respect for maternity care and what the rights are, those that have already been put across, then it's for us to check that do we have these vis-a-vis the challenges that we hear women go through and the facts, okay? When you look at some of the policy documents that speak to maternal health in Uganda, they already tell you the challenges that are already faced in Uganda. You will see the data talking about the maternal mortality. Yes, it has gone down, but we are not in a space where we are so happy to say that, oh, we are there. No, there is still a lot that needs to be done. And that speaks to the realities that we are going to talk about and build conversations around in the field as we do our coverage, okay? So when we talk about women who are not going to hospitals, that's already a problem. The question is, why is this happening? And we all know that if a woman doesn't go for antenatal visits, if challenges come later, no one is really is in a better position to help her because no one has their chronological history. Maybe they should have gone to the hospital earlier enough, but now it's too late. Maybe this would have happened, you know? So at the end of the day, all the stakeholders come into a fold where they have to discuss how they play their roles and what are the barriers. Because when we design this project, at the end of the day, what we are asking ourselves is this central question: what are the barriers that exist in Uganda right now that impede women from accessing respect for maternity care? Now, what does that mean when I say respect for maternity care? I'm talking about all women converging into antenatal, for antenatal services in health centers, whether it's for private for-profit, private not-for-profit, or in government facilities. The majority, of course, go into government facilities because they can't afford private care, okay? I'm talking about examples where we can see women not going to traditional birth attendants, but going to medical professionals. I'm also talking about amplifying the voices of the medical service providers, people I choose personally as Mona to call heroes, because these people don't work in very simple conditions. If I find a midwife who can tell me that in a week I deliver more than 150 births, and so far in the last 1 month, all these births have been successful, that is a hero for you. For me in Uganda, you cannot point a better hero. But if I begin to listen to the challenges that this woman goes through or this doctor goes through, my God, we need to talk about this as media, okay? Because if you have a midwife who, after leaving the day shift going home, she's called at midnight, and she has to walk like 2 kilometers to reach the health facility, the next question I have is, why doesn't this health facility, with all the decision makers, make it convenient for this woman, if she's needed, to have a place accommodation next to the hospital where they can only walk 10 paces and they are into the labor ward in case they are needed as a case of emergency. That becomes the question. So for me as a journalist, I become curious on that front and I'm going to follow that story. But I'm not following it to embarrass people. No, I'm not following it to point blame. No, I'm saying I want to discover the gaps and talk about these gaps. And once I've projected it through my media platform, the rest of the people will pick it up. Everyone is going to use that reference and talk about things. Ladies and gentlemen, you all know that every time we've talked about the issues that have come into even the national parliament, it's because someone made a coverage somewhere of a woman who died at a hospital gate because she did not have a mama kit. The implications being, how much money does it require for a woman to get a mama kit? Maybe we're only talking 10,000 shillings, maybe 15,000 shillings. But before you run to blame the hospitals, understand this, that those hospitals are working with very, very minimal budgets, okay? And there is also another question we need to ask. Why is it that a woman who is pregnant for 9 months preparing cannot raise 15,000 shillings to buy her own mama kit? Why will this woman turn up at a medical facility without even a pair of gloves? Of course, you have to ask the other question, for God's sake, why do we have hospitals that do not have gloves, medical gloves? So you see the dynamic keeps jumping from one place to another. We can talk about the medical service providers, we can talk about the medical facility, but we can also talk about those people who expect a service, okay? And women, rural women, are really poor. So maybe as we are talking about maternity health and respect for maternity care, the actual issue we'll be addressing at the end of the day is the poverty in this country, is the poverty in our communities, where if these women had the money, probably they would choose even which facility they go to. But here they do not have money. Here they cannot even raise 5,000 shillings within the 9 months to buy the mama kit, if that's what it costs. Okay, and here we are, where we have a hospital where the medical professional service providers are demanding for pairs of gloves or a plastic mat or something, you know, and you're like, why don't they bring it anyway in the first place? But before you go on to blame them, you realize they are standing there. You realize they are waiting for this woman and they are happy to receive her, only with one condition: come with a mama kit. So ladies and gentlemen, there are a lot of gray shades here. And it's up to us as journalists now, who are being invited now to begin working with an advocacy lens in our work, with the development lens, to begin to peel off these layers so that when we are reporting, we are objective to show all the angles and we can split. So you can take one theme, for example, and develop different angles, and all these angles come up with very interesting stories. At the end of the day, you always have to make sure that whatever you're writing, whatever you're developing, whatever program you did or documentary has an objective. But the objective is not to stir emotions or people to feel offended. Having said that, I have to be very honest that some things you write and people will not like them, but they are the facts. And I think as media, we've reached a point where we also have to honor and own our own. That at the end of the day, sometimes we write things that you don't want to hear, but that is our job. And I can guarantee you that as a person who is doing advocacy now, in advocacy sometimes people don't even want to open doors for us because they think we criticize them. Yet for us, we try to promote a conversation and a partnership where people should receive us because we are trying to work together. But sometimes we have to point fingers at them because they are the decision makers and it's not us. And they have to carry that responsibility. Now, very quickly, I'll also give some feedback to Olivia. You talked about disability. Yes, I was only trying to share some of the terminologies that we use, but which are important. And I think you will begin to pick on this language. And you're right, when you say differently abled, people will not understand that. So I totally agree with you. And you don't have to write a terminology so that you confuse people. You're supposed to use the language that people understand, that what makes sense to them. So absolutely use the terminologies that make sense to the reader, but also be sensitive to the people you're reporting about, so that there is that balance. Otherwise, at the end of the day, your objective of communicating should come first. And Olivia, I'll also would like to give you feedback that as part of our other work, the other objectives, already we've finalized what we call the RMC. And when you hear me use that terminology RMC, it simply means respectful maternity care. So we carried out an RMC assessment in all the target districts we talked about, and the results are ready. So we are going to share those with us also in our second orientation, not tomorrow, but the second orientation that will follow. And you look at all this information that came from the districts, and it's going to be interesting information for you because, and now I'm attempting to answer also Chemical Ali's question indirectly. When you look at the issues that were captured in these assessments, it already speaks to you about the issues that we want to cover and the issues we want to talk about under the maternal health or the respective maternity care. And there are very interesting issues that came from specific districts, but you can also be able to see similar issues across all the districts, including Kampala, which again says something that Olivia was asking, that why these particular districts only. I don't know if it's Olivia who asked or someone. Angel asked, why are you only targeting Eastern? One, we targeted Eastern because White Ribbon Alliance was already there, and we already had a volume of work which was speaking to the dire challenges and the issues regarding maternal health in these districts. Plus, when you're already in a district, chances are you already have partnership stakeholders, so it's easy for you to insert yourself with a program. Actually, our partners, USAID, these districts we picked were not majorly the districts they focus on with their indicators. So they were like, guys, you have to look at our districts. But we convinced them and we showed them the data, and they said, no, you're right. Focus on the districts where you've started. But then we had also to show cause that we will tap into other districts. So that's why we crossed over all the way from East to Masindi. And as I told you, it's very interesting what's happening in Kampala, despite the assumption that there is a lot of access to services. Kampala really has very shocking data. And all this information you'll get in the second orientation. They will really speak to you about the figures and the statistics and what's happening at the moment. So those are that's maybe the quick feedback I wanted to give. Julius asked the last question, and that's what I wanted to finish with. He talked about the question of sustainability, considering that programs that were once funded by DGF were abruptly shut down by government. I mean, these realities sometimes hit us, and sometimes it could be another reason why a program shuts down ultimately. What I want to give you as an assurance is that what we are doing right now is that the support we are getting from White Ribbon Alliance is meant to actually just complement the work that we are doing. So once they give us the capacity and the capabilities to do what we do, it's our opportunity to run with it. And that was actually one of the things that they considered, because this was a competitive kind of bidding. Different people gave in proposals, but our design gave us an edge to get the support that now we are using to be able to have these interactions and the like, because we try to show them that we're already doing our work, and what we are interested in is for us to be facilitated to convene our platforms and to make ourselves stronger. And they already saw sustainability in this. That's why I said, and I know Olivia also talked about it. Olivia, when I talk about us being experts, it's because we are. We are as media people, but then now with these new dynamics of building partnerships and bringing themes and subjects starting with respect to maternity care, it only gives us an opportunity to dive deeper into this area and do our work where we already know the craft, but to be able to exploit it and then see what we come out with at the end of the day. So in terms of sustainability, whatever we do has to sit with us. The support that we get, whether it's capacity building, whether it's to facilitate us to do specific things, it has to sit within our realm so that we can do the work. And moving forward, we can work independently and run with this information as much as we want. And this is why I want to tell you guys that, for example, if we do some angles in our work of respiratory maternity care, but Native is able to bring other stakeholders on board who want to take different specific angles, and they're saying, oh, we can facilitate you to do this and the like. That's what we should be focusing on. That's when the sustainability builds in. If we build a body of work and other people say, we also want to continue to support you so that you can continue with this work and work the way you've been doing it, absolutely. But we have to keep that at the back of our mind, that we have to build this in as we go forward. So look at this as a startup where we've been given an opportunity to do this work, but the building and the volume of information that we are going to build and the knowledge and the interactions, that is for us to sustain. And we can always talk about how we want to do this. As I told you, the other branch which is in a shadow, and that is the Ideas Atelier, that is part of the work that we are going to be doing. That how do we build sustainability, and we keep coming up with these themes and ideas that we can build moving forward. Sarah?
Thank you very much, Herbert. Well elaborated. I think I would be doing injustice to repeat what you have said. I just want to emphasize a few things, but in line with what he has already explained. And one of the things that I want to elaborate is that, as he said, facts, and now I'm responding to Julius. Facts, facts, facts. But also, as a filmmaker, there's something called tone, and how you manage your tone. And I think Native Voices, we'll be talking about how Native Voices wants to journey with you tomorrow. So I don't want to start that, but part of what we are looking at is that it's not a fight, what we are going to do.
Yeah.
But how do we pass on this information without looking like we are attacking, but positive, objective criticism or provision of information with a view of actually coming out with solutions, which is why part of the program, as for instance, Herbert, it's not a coincidence that Herbert says that these health workers will sometimes be rude to people, yeah, and maybe slap a lady in labor. Not that everyone does it, but there are some who do it. But he's the same Herbert who then comes and tells you there are impediments. Why has this woman worked on 100 mothers in one day? Why does she have to walk to come and aid a mother in labor? What is not happening? So it means that we are also supporting them. So today, and we are also critically like wearing lenses that are actually looking at their challenges and also how they can improve. So Herbert puts it better, building the agenda, and I think tomorrow he will elaborate on building agenda building. But I'll stick to a filmmaker's lanes, and in the earlier days, I think now the tone is quite clear, but in the earlier days there was a monitor tone which was very critical and built this country, contributed significantly. But there was also a new vision tone which could also bring out this information, but probably not as strongly. And I'm not saying that we shouldn't be strong or vision wasn't giving the facts. I'm just saying, how do we choose the tone not to lose the facts and the information and the action points, but still be respectful in our tone, be deliberate to onboard the people as opposed to putting them in defense mode. The same applies to government. Government may not want to hear these things, but as Herbert has said, these things are happening. And when you go into government, you have actually chosen to serve, so serve. But how do we tell them to serve without patronizing them or looking like we are fighting them? Because it's possible. And I'm not saying any of the newspapers we have is less, because they also do an awesome job. But I would like to talk about the Observer. I'm not saying that they've not been sued, but they have always come out with the same information about the issues that other media houses are also coming out. But maybe they won't be taken to court the way red paper sometimes has been taken to court. Yeah, it's because red paper has chosen that tone, and Observer has chosen the tone they have, but they still give information. So we are going to be very deliberate, and we want to partner with you in making sure that this information is perceived in the spirit it is meant, which is to promote respectful maternity care and the fact that no mother should die while bringing a life, but also the lives should not be lost. And the choices, there are things like when someone talks about choice and someone says those people are spoiled, that's a luxury, but we'll be hearing from experts and we'll understand why choice is very important. I'll also go now to Moses. I think earlier I was dealing with Julius, but Moses. We will also engage. Are we engaging officials from the Ministry of Health? Yes, we are. Because by the very nature of the Ministry of Health, their work is actually to support what we do.
Yes.
And they will be doing themselves a disservice if they don't support what we are doing, because we are complementing their efforts. We may point them to areas they are not aware of.
Actually, it's their mandate.
Yes, but what we are doing is their mandate. So ideally, they should see us as enemies. But also, as Herbert will explain tomorrow, we have task forces. And I think in the districts, the district health officer is the head of the task forces. So we are already working with the ministry, because we will introduce you to the task forces in your respective districts. We are going to come and visit. We wanted to come after we've had this orientation, such that when we go to visit and we meet the task forces, probably we are doing it with you as people that we have been engaging with. So yeah, we are working with the Ministry of Health in a sense that they are aware of what we are doing. We are not going to keep quiet. They will not ask us that. We will give information because we trust what we are doing is their mandate, but we will strive and encourage you to strive in your respectful media houses to be objective. And when one is objective and they have the facts, people might not be happy, but they will agree that these things are happening. I think the issue of funding, Herbert has talked about it. I think I would also like to, tomorrow I would be explaining how we'll work with you in terms of probably facilitating. But this is not like a huge fund where we've got monies to like ace, or if they close, we are out. The reason, for instance, they went out for Native Voices is because already Native Voices is working with communities to amplify voices, community voices. And one of the things we do to amplify the community voices is having community-based people report, film, put out their voices in the media. So that's why we realize that Native Voices is thin. We are a small team. We can't be in all the areas. But when we have people we have given the skills and tools to talk about these stories or things that are happening from their perspective, then they are going to actually put out and amplify the voices. So what they are doing is to facilitate us to do what we are already doing or should do. Note that, so if they, for instance, stop, and that's why we are also coming to you as media houses. I want to hope that the skills and tools you would have gotten will point you to a story where there is issues of respectful maternity care. They will point you to a story, they'll interest you. We want to develop your interest. If it's already there, and I imagine it is, we want to root it even deeper, whereby if you are reporting and probably maybe we are not in position to facilitate, you're able to convince your editor or people in your communities or stakeholders that it is an important story and we need to put this voice out there. So in as much as this project is here, I want us to own the process such that at the end of the day, the skills will stay with us. I hope that the passion, that you pick interest in these things and become passionate about that. But that's not something we'll enforce. It will depend on, but I am very sure that if you go and follow up the stories as we hope we will, the themes we will come up with, by the time we are done, even if you don't follow up, you have a better understanding and more deeper appreciation of the issues surrounding respectful maternity care, and you will be advocates with or without support, even in your own conversations. So I want us to look at it like that. But tomorrow we'll be giving details, and in the workshop how we will journey together in this agenda. I think it was Olivia. Olivia talked about not being experts, and I think you handled it well. But I also liked the fact that you said you're learning. And I have been in the media for over 20 years, and even yesterday and today, just now, as we were having this conversation, I learned something. Life is a school and a journey. And the thing about media, for me, the takeaway, when I die, the takeaway from life will be that media gave me the necessary exposure, because an ordinary person does not have the same knowledge that I have. Why? Because as a media personnel, I interact with lawyers, politicians, health workers, and that has been a school for me, and I have learned a lot. And I'm talking to people, and I think it happens to all of you, and you have a sense of what's happening in hospitals, you have a sense of what's happening in court, and people are like, how do you know this? I'm not extra intelligent, but life and my career has helped me and given me the necessary expose to learn these things and know these things. The only difference probably is that I have a passion that when I hear it, I pick interest and probably push. Not everything, but those that I pick, I go for them. And that's how I hope you are able to seriously pick interest and passion to promoting respectful maternity care. That at the end of the day is going to fall back on you as individuals, but also fall back on your media houses. That's why for us, the media houses are also partners. We are having conversations with your editors, but we'll explain this tomorrow, because we know we've been, me, Herbert, we've been journalists. We know that there has to be a buy-in for editors. So they need to be onboarded in this project. There has to be a buy-in for media houses. Otherwise they might think, hey, you have been paid adverts. That's why for these 2, 3, 4 months, you're only doing those stories. So we need to explain when we come to your communities or your respectful districts. We'll talk to your news editors. We'll try and pay visits to the national editors. We've been talking to some of them already. I'm not saying you go and say, hey, hasn't this person talked to you? We have no shares in the media houses, so you still also have to pitch. But also part of how we will support you is looking at your stories and discussing with you what makes it even look stronger, and how do we tackle it, like Herbert said, 2 heads are better than one. But also for us, hearing from you and being guided on where you think we should go is also critical. I think the issue of sustainability has been handled. Thank you very much. Back to you, Herbert.
I want to end by encouraging you that the work that we want to do really should be a work of creativity. We really want to also deepen ourselves into innovations. And Sarah said something that was so interesting, even for me. I share the same sentiment with Sarah. Every time I meet people and we sit and we start exchanging ideas and having conversations, for me it's a learning moment. I learn a lot of things. So I know one of the things that I can guarantee is that I'm going to learn a lot from you. And that's why I call you experts. I'm not saying it just for the sake. I know and I believe, and I'm very confident when I say you are experts in your field, and I look forward to learning from you. The thing that is very important for us is to appreciate that we are coming from all kinds of backgrounds and environments, even if we are in the same profession, But we are going to have an opportunity to learn and collaborate a lot with each other as we work with this theme. Number two, it gives us an opportunity to really directly engage with all those stakeholders, including national decision makers. And we engage them on these issues, not because we just do our job as media people, journalists or whatever, but because when I say that we are going to be people who now use media to do advocacy, that is a new field that I want to invite you to, and I'm going to usher you in, and I promise that I'll give you the capacity for you really to now understand what advocacy does. And that is going to put you at a whole different level. And that is an opportunity for you to really pick new skills, and then who knows, when I talk about innovations, and I know we are going to use a lot of innovations, depending on how this information hits you and how your impressions come about, considering that you're already an expert in media, that's when your creativity will open up, and then you will run with this in different directions or to a different level, and that I can guarantee. But what does it help, or what does it mean when all of us converge together and bring our ideas into this media lab? You will see that we are going to really have a rainbow. A rainbow in the sense that if it creates that different people are going to give different results, and we must celebrate these results. Different people are going to build different linking points and points of impact that bring us to our objectivity, and we must learn from that. And most importantly, that we are going to be a different new breed of advocates who are using our expertise in media to do advocacy. That means that whatever we are going to do, it's going to contribute to the development agenda of Uganda in such a way that can impact change. That is what, as advocates, we should aim for. We want to impact change, but this change we must be able to clearly define for ourselves. We must define that change so that we are clear on how we can achieve it and how we are going to use our professions to do just that. And as we've said, when it comes to the support and the help that we need, it comes in different forms and sizes and shapes. So we will need sometimes support in terms of finances, and if those finances we have, we'll be able to share with them with everyone. For example, if we are doing stories and we say Native Voices can support us to facilitate writing of a story, and they clearly can. Native Voice will pronounce itself on that, and they'll tell us that we can support you with so much for so many times and whatever. But it will also be our responsibility to appreciate that our work is what will be our golden passport to attract other people who are going to also be interested in us furthering primarily this theme of maternal health, and then other people will come with different themes altogether. And that's why I told you that this is a platform where you come in with the full knowledge that it's going to be a new adventure for you. And I promise personally, for me as Mona and Sarah, that Sarah I know already, I have absolute guarantee that we'll make it as interesting, as adventurous, and as fascinating, as attractive as possible for you. But here is the catch. We can only make this work if we all bring our game on board. It cannot be a one-sided, it's a give and take. So when I tell you guys that we are going to use this opportunity, for example, to be trained in advocacy and media, that is going to happen because I'll be able to do that. And not only me, but I'll bring all the other people I've worked with in the past to usher in and share their knowledge. And here we are privileged that people are willing to give their knowledge. And once you receive this knowledge, it puts you at a different level. And then we'll be able to work together. So don't get any anxiety that this is a field that I need to understand. We will make sure that you get the right information. We will make sure that you have absolute clarity 100% on anything you want to be explained to you. And then once you're comfortable with this theme and the area of respectful maternity care, we'll expect that now you can use your skills and the newfound skills and adopted skills to bring out a new body of work, which should have an objective that we want to create change. And slowly by slowly, you'll begin to see all these other stakeholders join us and come on board to work with us. And that's why I say that it's going to be as fascinating, as interesting, as adventurous for each and every one of us. But I promise you that I think it's going to be very important that we work together. We don't want to leave anyone behind. That is a theme, by the way, that we carry in White Ribbon Alliance, that we don't leave anyone behind. Everyone has to be part of the collective. And I think even some of the disciplined institutions in the world, like the army, when they are being trained, one of the cardinal principles that they train army people in their discipline is that if it's a platoon or a regiment, you work together and you move together. And if you feel one of your colleagues is slugging behind or they are remaining behind, you all have to go back and bring them. And you might realize that bringing back that one last person to them becomes more important than all of you, the majority of you, just progressing and leaving them behind. And that is really speaking to our discipline, that if we come together and we coalesce together, we will be a united force. That's the first topic that you learn in advocacy, that in advocacy we speak one voice, which means when we are going to work together in respect for maternity care, we might run with different stories, but they'll all be focusing on specific themes where we all as a collective have agreed that these are going to be our themes and these are the themes that we respond to. And with that, we'll not leave anyone behind. We'll make our work collaborative, we'll make it interesting. And I promise you, if we do everything right, we'll attract the kind of support that we seek to move ourselves further and to sustain ourselves. So thank you, and I look forward to talking to you more about this tomorrow. Sarah.
Thank you very much, Herbert. I know you will make it interesting. We will make it interesting, but I know you give the content that will even elevate it to another level. So we really look forward to working with you. There is a question that we had missed from Olivia, and she says, she said, but I put my question. Sorry, Olivia, we had missed it, but now we've seen it. How are we going? Are we going to work with any particular organizations in their districts? And if we are going to work with the organizations in these or health facilities, exactly which and how is it going to be done? I would like to share that we will continuously look for partners, but for now, especially in Busoga, we are working, we are in conversation and with the First African Bicycle, Fabio. You know that they've been, the people in Busoga know that Fabio has been at the forefront of pushing for respectful maternity or maternity care generally. In COVID, Fabio was amazing. They provided these border bikes, then they provided where if a woman was going to labor and there was no transport, particularly with all the transport challenges, accessing the ministry vehicles and all that, someone would go and get that cart or get a bicycle. One of the interesting stories is that they put bicycles in areas of local councillors. So if because the chairperson knows if indeed your wife is expectant and which level, which month. So you go, you pick the bicycle or the motorbike and you go to hospital. And we received, because we are documenting something for the GMT, Gracia Machel Trust, effects of COVID on women, and one of the areas we are looking at is also maternity. And yeah, we saw these stories of women who were able to deliver timely and access health facilities thanks to Fabio. And the beauty of Fabio is that it is throughout Busoga. They are in Jinja, they are in Kamuli, and they are in Iganga, and I am sure, Olivia, you interact with them. But that does not mean that we are limited to Fabio. We are looking at community-based organizations, and so if you know of any, you can let us know. The partnership is going to be people who are interested in pushing for that, because there might not be monetary gains for them. We are also looking at you and requesting you to support editorially or in terms of amplifying their voices. Those organizations and community-based or national in nature, but in your localities, that are actually pushing or supporting maternity care. Yes, we will work with health facilities, but in principle now, the public facilities that are in your areas, because the DHO is the head of the task force. We are naturally getting that connection, but it does not stop us to work with any other partners and stakeholders. As Herbert hinted, we are open to more, even others that are not probably health facilities. For instance, there are people who are not care providers, healthcare providers, and are not media, but are critical, like the VHTs, the Village Health Team members. We are going to work with them. They are privy to a lot of information. We also strongly encourage you to work with them. Citizen journalists, there are people who are not necessarily journalists, but probably have interest in the media and are willing to give information. We want to work with them, and we want to encourage you to work with them. There are people like, because now there are local councillors, secretaries for information, like Native Voices on principle works with those people, because we understand that their mandate, unless they don't do it, is to collect information. We will also want to have conversations with secretaries for women affairs in their respective areas, because they are also privy to certain information if they actually honor and do their job. We also want to work with people who represent the people with disabilities and youth. Why? Because the disability is an issue of the differently abled people. And now that I talk about this, it also reminds me of the question of the language we use when it comes to people with disabilities. And I think sometimes being very polite can be limiting, in a sense that they are different, people are differently abled, yeah? And you want to talk about a lady who couldn't access the bed because she has no limbs. So you will be limited if you're not able to express exactly what happened, and you say a differently abled woman who couldn't go to the bed, why couldn't she go to the bed? So I think it is in the English dictionary that someone is disabled, but the tone you use and the language will be very helpful, and how you bring it in, like how you put in a sentence, the lady could not access the bed because she has no limbs. That's a fact, and people will appreciate that. So we hear you. I think what we are pushing for, as earlier indicated, is polite, respectful language, but also understanding development work language, and not just being seen to be doing it, but embracing it as a culture going forward, probably even on other projects. And by the way, like the way we say it, that we are working with the Ministry of Health, we are also cognizant of the fact that people like RDCs and other people might be critical, they might have useful information, so we strongly encourage you to go to them. When we come, we are going to introduce ourselves and tell them about the project, because I think now the cow, originally when it would come to security matters and stuff, you would go only to the RDC, but now the cow and the RDC. So when we come, we'll go to the district, we'd like them to be aware of you, we want to tell them, to give them your contacts, but we want to also notify you in advance when we are coming, so that hopefully you leave a window, or you save some time to join us, so we have a face-to-face conversation, but hopefully you're able to go with us to some of these stakeholders when we go to meet them. See you. Thank you so much. All the best. Thanks. Bye.